Alhamdulillah. Alhamdulillah nahmaduhu wa nasta'inuhu wa nastaghfiruhu wa nu'minu bihi wa natawakkalu alayhi wa na'udhu billahi min shururi anfusina wa min sayyiati a'malina man yahdihillahu fala mudilla lahu wa man yudlilhu fala hadiya lahu wa nashhadu an la ilaha illa Allah wahdahu la sharika lahu wa nashhadu anna sayyidana wa sanadana wa habibana wa maulana Muhammadan abduhu wa rasuluhu صلى الله تبارك وتعالى عليه وعلى آله وصحبه أجمعين يا ربي صلي وسلم على النبي المختار محمد المصطفى صلى الله عليه وسلم ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي ربي اشرح لي صدري ويسر لي أمري واحلل عقدة من لساني يفقهوا قولي سبحانك لا علم لنا إلا ما علمتنا إنك أنت العليم الحكيم ربي زدني علما وارزقني فهما. My dear brothers and sisters, young and old, Assalamu alaikum wa rahmatullahi wa barakatuh. MashaAllah, welcome back to another episode of Your Health, this health program, in where we try to bring nuggets of information to you. Significant nuggets of information that can have a big impact on your health. My friends, we are in this dunya for a limited time. And what we see around is we kind of give priority to, wealth more than we give it to our health, in the majority. Whereas the Hadith Sharif tells us that one of the best things that you've been given is your health. Your health is one of the biggest things you've been given. In fact, the hadith which tells us value 5 before 5. One of the 5 things is value your health before you become unwell. Value your health before you become unwell. I mentioned in the past as well, inner city environments where Muslims predominantly live, their mortality rates are really, really low compared to more affluent areas. And there's reasons for that. Lack of good nutrition, pollution, lack of information. And also, I was reading a report a while ago, just generally, it's a very disturbing report that people of the kind of ethnic minority background and the black minority background, their diagnosis when it comes to cancer is in some instances 100% more delayed than the average white Caucasian population. 100%. Certain cancers, the people of ethnic background and blacks have to wait double the time. And when it comes to cancer, time is of the essence. May Allah Ta'ala keep us all safe from cancers. And inshallah, we're going to talk about that very soon as well, how to make your body strong, inshallah. So, the Asian areas and the a population of Asian people generally, their health, is always below par compared to the wider kind of population, and there's reasons for that. Now, today we're going to talk about, inshallah, one particular reason that impacts massively within the Asian community, massively. In fact, if I change the name of this vitamin and give it a different name, and then tell you the benefits of this vitamin, you would all be, spending your hours just finding this and ordering this. It has such an impact on your health. And one of the things that is a factor in its synthesis is the amount of melanin we can have in our bodies. Melanin is a kind of a hormone that affects the synthesis of this vitamin. Melanin is a hormone which affects the color of our eyes, our hair, our skin. The more melanin we have, the more darker our eyes are, the more darker our skin is, and the more darker our hair is. And the less melanin you have, the less lighter is your eye color, the less lighter is your hair color, and the less lighter is your skin color. Now, what makes us have more melanin? There's different factors. Some is, our genetics, and some is the amount of exposure to the sun our ancestors had. So the more exposure to the more melanin you have, the more darker will these characteristics be, and then the more darker these characteristics are, the more difficult it will be for this particular vitamin to be synthesized and be changed into its effective form in your body. Now, I'm hearing you think, what is this vitamin? Some of you might even guessed. I am talking about ergocalciferol or calciferol, to give it its technical name. Ergocalciferol and calciferol. There we are. Now, what do you understand from these names? Some of you will understand that I'm talking about vitamin D. Vitamin D. मैं आज विटामिन डी की बात कर रहा हूँ. मेरे अजीज़ भाइयों और दोस्तों, विटामिन और बहनों, ये जो विटामिन डी है इसके बहुत ज़्यादा फ़वाइद हैं, बहुत ज़्यादा फ़वाइद हैं. हर आदमी को मालूम करना चाहिए विटामिन डी के लेवल क्या होने चाहिए. यूके के अंदर लेवल अलग हैं, यूरोप के अंदर लेवल अलग हैं, स्टेट्स अमेरिका के अंदर अलग हैं, और यूके के अंदर सबसे लो लेवल हैं. तो वो कहते हैं कि भाई अगर आप 50 मिलीमोल्स पर लीटर ऑफ ब्लड आपके यानी विटामिन डी हो तो आपके लिए ठीक है. In Europe is higher, in the States is even more higher, and therapeutically is even more higher. तो आपको अपने आप को आगाह करना चाहिए कि विटामिन डी के लेवल कितने होने चाहिए. जब आपको जीपी कहते हैं कि भाई आपके लेवल ठीक हैं, आपको कहना चाहिए कि जज़ाकल्लाह खैर, लेकिन आप मुझे बताएं लेवल क्या हैं. We need to familiarize ourselves with their levels, all these levels, just so, because it's our own body, all right? It's very important, and our GPs are overworked, overstressed, too many patients, so they can make mistakes. They're not robots. They make mistakes, many mistakes, if you look at the studies. So it's important because you're an important stakeholder in your health. Who can be more concerned about the health than the person themselves? You know, modern medicine isn't a religion. It doesn't require blind faith. I mean, there's nothing wrong with blind faith. ذلك الكتاب لا ريب فيه هدى للمتقين الذين يؤمنون بالغيب ويقيمون الصلاة ومما رزقناهم ينفقون. We are believers. We believe in Allah. We believe in the unseen. We believe in the hereafter, the angels, Allah Ta'ala's books, alhamdulillah, by the grace of Allah, because we are the believers. But that's our deen. Everything else, you should be inquisitive. You should be curious. In fact, it's knowledge. So you should find out from your GP what your vitamin D levels are, what your kidney function level indeed is, what your ALT levels are of your liver function, your iron levels, serum ferritin levels, hemoglobin levels. It's very important for you to know. And it's not, rocket science. आसान है. हर आदमी के लिए लाजमी है कि वो आपने BP का यानी कि लेवल पता करे, आपने जो आयन की जो स्टोरेज लेवल्स है, सेरम फेरेटिन के लेवल इनको मालूम होना चाहिए. हीमोग्लोबिन लेवल्स, आपके लिवर के जो लेवल ALT लेवल्स क्या हैं, आपके किडनीज के EGFR लेवल्स क्या हैं, कोलेस्ट्रॉल, होमोसिस्टीन लेवल्स आपके क्या हैं, विटामिन डी के लेवल क्या हैं, और आप फिर खुद आपका अंदाज़ा हो सकता है कि भाई, क्योंकि क्या होता है कि अगर किसी की उम्र 50 हो तो उनके लेवल अगरचे कम क्यों ना हो, लेकिन आपके जीबी कहेंगे भाई ठीक है, आपके उम्र का लिहाज, आपको नहीं बताएंगे उम्र का लिहाज, लेकिन आपको कह देंगे कि आपके लेवल ठीक है. किसी और के लेवल अगर कोई और उम्र के लिहाज वो करते हैं, लेकिन ये लिहाज नहीं होना चाहिए. If you are 60-70 years old, your levels, if they are low, your consultant will say, your levels are fine. Why? Because it's your age. It shouldn't be your age. We've just seen the death of Queen Elizabeth II in front of us. And we've seen her service to this country from the age of 25. Age of 25, she became a monarch, the longest serving monarch in the history, more than Queen Victoria. She served 70 years. And just a few days ago, she was meeting Liz Truss, and she seemed fine. So her health was remarkable. Did you know, when I keep saying homeopathy, the medicine of royalty, I am not making this up. The Queen, deceased, was a big proponent and a she benefited from homeopathic medicine. Indeed, the whole royal family benefited from homeopathic medicine. Alhamdulillah. For decades. Just recently, Dr. Peter Fisher, deceased as well, who was the he was the physician, the homeopathic physician to the Queen. So they benefited. Whenever the Queen travels or traveled, she would have a black kind of a small box containing homeopathic remedies. So, she benefited from homeopathic medicine. The reason why I mentioned the Queen is that look at her health. She would be in bed by 9:30. Her food was of the best quality. Walking regular, exercising regular, and alhamdulillah, it was in her qismat to live to 96. You see, many people don't survive, the death of their husband. I was just told that she became very frail after the death of her husband, and you see this in real life. When a husband passes away, generally, the wife has such a shock that they don't last too long, and vice versa as well. Such is the link of this ajib companionship that Allah Ta'ala has done, has made for us, that of marriage, nikah. Allah Ta'ala says in the Quran, وَمِنْ آيَاتِهِ أَنْ خَلَقَ لَكُمْ مِنْ أَنفُسِكُمْ أَزْوَاجَكُمْ. That Allah Ta'ala says that He created for you from yourselves your spouses. Subhanallah. Only Allah knows the secrets of the rules and what happened in the alam arwah. But my friends, we have a जिम्मेदारी to look after our health. मैं ये कह रहा था कि हमारे लिए हमारे जिस्म का ख्याल करना, हमारे रूह का ख्याल करना, यानी हर चीज़ का खाने का ख्याल करना, नींद का ख्याल करना बहुत ही लाजमी है. हम लोग दुनिया की तरफ तवज्जो ज़्यादा देते हैं और सेहत की तरफ तवज्जो देते हैं ही नहीं, या बहुत कम देते हैं. दुनिया के हुसूल के लिए, दुनिया के कमाने के लिए हम बहुत कुछ करते हैं, लेकिन इसके बरखिलाफ़ जो हमारी आखिरत है वो भी ज़ाया हो जाती है, और दुनिया के अंदर जो हमारी सेहत है वो भी उसके अंदर नुकसान आ जाता है. तो ये एक किस्म की अहमकियत है, होशियारी नहीं है कि आदमी दुनिया को तरजीह दे, पैसे कमाने को तरजीह दे, बैंक बैलेंस को बढ़ाते जाए, और इसके साथ इसके मद्दे मुकाबिल जो आदमी की सेहत है उसकी तरफ तवज्जो ना दे. फिर आदमी को बीमारी हो जाती है, डायबिटीज़ हो जाती है, हाई ब्लड प्रेशर हो जाता है. तो इसकी वजह से आदमी की जो ज़िंदगी का जो मायार है वो बहुत कम हो जाता है. आदमी को बीमारियां बढ़ जाती हैं. फिर ये जो पेरिफेरल डिजीज़ होते हैं, आदमी के हाथ पाँव के अंदर जो यानी जो वेन्स वो ख़राब हो जाती हैं, जो डायबिटीज़ के कॉम्प्लिकेशंस हैं, आँखों के अंदर जो नर्व हैं वो ख़राब हो जाते हैं, किडनीज ख़राब हो जाते हैं, आदमी लाचार हो जाता है, तो मोहताज हो जाता है, तकलीफ़ से यानी उसको दरगुजर होना पड़ता है वगैरह. इट्स नॉट गुड क्वालिटी ऑफ लाइफ एट ऑल. तो ये जो हमें नबी करीम सल्लल्लाहु अलैहि वसल्लम ने बताया है कि आदमी हर मंडे और थर्सडे रोज़े रखने चाहिए, हर 13, 14, 15 हर महीने के रोज़े रखने चाहिए, जल्दी सोना चाहिए, ईशा के बाद कोई यानी गपशप के लिए नहीं, बिल्कुल आदमी सो जाए, तहज्जुद के लिए उठे. या अय्युहल्लज़ीना आमनू कुलू मिनत-तय्यिबाति वअमलू सालिहा. कुरान शरीफ के अंदर है कि हे ईमान वालो, अच्छा खाना खाओ और नेक अमाल करो. अच्छे खाने यानी तय्यब फूड, ऑर्गेनिक, फ्री रेंज खाना आपको खाना चाहिए. Not all this rubbish that we get from these fast foods. It's crazy. If you had a car, maybe you bought for £60,000, would you go and put, like this fuel made from vegetable oil? You wouldn't put that inside. So we put this in our bodies. That just should tell us everything of our brain set. We put rubbish, we have this Coca-Cola, ya Allah, and fizzy drinks, carbonated drinks, which leach magnesium and calcium and boron from our bones and phosphorus. I'm guilty of it as well. Before you say, to a degree. But some of us, 24/7, we're at the takeaways. Inna lillahi wa inna ilayhi raji'un. The outcome will not be good at all, and we're seeing this in our populations, the Asian populations, breaking all records in diseases. If you look after ourselves, we can be like the Queen. She was in good health all the way to the end. Her senses were very, very strong, intact. No senility, no dementia, no Parkinson's. She was strong. She was, if her husband hadn't died, then maybe the Queen would have lasted a lot longer. You see, and she did her khidmat of the population. She kept her family, strong. She was like an anchor for the royal family. So it's a big loss for the UK, no doubt, you know. Man lam yashkurin nas lam yashkurillah. Whoever doesn't show gratitude to their benefactor doesn't show gratitude to Allah subhanahu wa ta'ala. Something to ponder, my friends. So we need to look after our health and, you know, maybe enjoy the same health as the Queen, inshallah. Who knows? I'm sure, you know, a patient was saying to me just yesterday, one of the doctors who came to consult, it was a female, she was saying her father in Bangladesh is 95 years old, mashallah. 95 years old. Amazing. And he's, you know, perfect. Nothing wrong with him apart from some issues with his prostate, I think. So 95, mashallah. Allah give him a long life. So my friends, this is very, very easily achievable. When we hit 60, 65, our joints are in pain. We are forgetting things. Rheumatism is ravaging our body. You know, it's not a good existence. We're waiting for some transplant or the other, or waiting for knee replacements or hip replacements. Ye munasib baat nahi hai. This isn't the inheritance that we've received from our ancestors, my friends. Our ancestors were strong people. And why were they strong? Because of the food. The food. I read a while ago a report published, the Black Report in 1980, which says that 3/4 of cancers, apart from the cancers caused by carcinogenics of the lung, like smoking, 3/4 of other cancers are caused by food. You know? So isn't it better to fast then? Of course it's better to fast. But today, I want to speak about this egocalciferol or calciferol, i.e. vitamin D, and how important it is and how much it'll benefit your and my health. So this vitamin, I'll try to speak in Urdu and English as well. We have a lot of viewers who are Urdu speaking. तो आज इंशाल्लाह विटामिन डी के फ़वाइद आपके सामने रखेंगे इंशाल्लाह। उम्मीद है कि आप इससे आपको नफ़ा होगा, फ़ायदा होगा और आप इसकी तरफ तवज्जो देंगे इंशाल्लाह। हर किस्म की बीमारियों के लिए विटामिन डी बहुत ही अच्छा है। यानी आपके सामने, आप मिसाल के तौर पर जो ख़वातीन होती हैं उनको एक बीमारी पॉलीसिस्टिक ओवरीज होती है या PMS, प्रीमेंस्ट्रुअल सिंड्रोम के जब उनको यानी उनके हैज़ के जो अय्याम आते हैं तो उनको बाज़ ख़वातीन को तकलीफ़ बहुत होती है वगैरह। तो ये जो PMS है और ये जो पॉलीसिस्टिक ओवरीज है, पॉलीसिस्टिक ओवरी एक यानी जानने के जो ओवरीज होते हैं ख़वातीनों की, वहाँ सिस्ट एक छोटे छोटे यानी गुदूद पैदा हो जाते हैं, जिसकी वजह से उनके जो हैज़ के अय्याम ख़राब हो जाते हैं और उनको यानी बच्चों की हमल वगैरह होना मुश्किल हो जाता है वगैरह, और बीमारियों को होती हैं। तो इसकी एक बहुत बड़ी वजह है विटामिन डी की कमी। विटामिन डी की कमी। तो 6 बड़े फ़ायदे हैं, हम आपके सामने इनको विल गो थ्रू दीज बेनिफिट्स फन टू यू इंशाल्लाह आपके सामने बयान करेंगे। विटामिन डी जो है, विटामिन ए, डी, ई, के, ये सब आपके फट के अंदर ही जमा होता है। तो यानी ये बहुत अगर इस्तेमाल हो वरना अंदर ही यानी ये महफूज होता है। और जो विटामिन होते हैं या मिनरल्स वो पेशाब के ज़रिए निकल जाते हैं। विटामिन ए, डी, ई, के फट सोल्यूबल विटामिन हैं। तो आइए देखते हैं विटामिन डी का फ़ायदा क्या है। इसके बहुत फ़ायदे हैं, ये समझें, बहुत ही ज़्यादा फ़ायदे हैं। ये आप इसके अंदर दोगा ना खाएं कि भाई विटामिन डी, हाँ विटामिन डी, चलो भाई लेट्स टॉक अबाउट समथिंग एल्स। विटामिन डी इज़ वेरी इंपॉर्टेंट। डोंट गेट फूल्ड just because of the name vitamin D. Do your research or listen to this program. So vitamin D does a lot to help keep your immune system functioning at its very best. We know that. That's why it's one of the things which was recommended for COVID. It regulates the innate and adaptive immune system. In fact, you know, your cells have vitamin D receptors. Your cells contain vitamin D receptors. It affects the cells, all cells, your heart cells, your immune cells. One study suggested that a deficiency in vitamin D increases the risk of immune-related diseases. You know that. And if you have, it gets rid of viruses, bacteria, and parasites. Vitamin D. So let's talk about this. So first of all, it supports your immune system. It boosts your immune system. That's why the army, when COVID hit, all the British Army personnel, they all got vitamin D IM injections, intramuscular injections. 300,000 calciferol, 600,000, whatever it may be, they got the injections. So number 1, it boosts immunity. विटामिन डी जो है आदमी की इम्यूनिटी को बढ़ाता है। हर किस्म के जो पैरासाइट्स होते हैं, बैक्टीरियाज होते हैं, वायरसेस होते हैं, उनको हटाता है, उनको दिफा करता है, क्योंकि आपके इनेट इम्यून सिस्टम को ये गोए के ताकत देता है। बोथ इनेट और अडेप्टिव इम्यून सिस्टम को इनके जो सेल्स होते हैं तो उनके अंदर विटामिन डी के लिए गोए कि एक रिसेप्टर जगह होती हैं जहाँ विटामिन डी आकर उन पर मुतासर हो। तो विटामिन डी लाजमी है इम्यून सिस्टम को बढ़ाने के लिए। नो boosting of the immune system formula is complete without vitamin D. Number one. Number two, it may boost your mood. How many guys have got anxiety and depression? Some are even suicidal. You know, do they check the vitamin D levels? I don't just mean, oh yes, they're okay. No, I mean, what's the therapeutic amounts? They should be more than okay. So people with depression, how many guys do you know have depression? It's one of the most commonly prescribed, serotonin, Prozac, etc. Mood inhibitors, SSRI, selective serotonin mood inhibitors. And I've shown you before, is completely the theory is, research has made it redundant that it's the wrong prescription. Depression is not caused by serotonin deficiency; it's caused by adverse effects. So vitamin D help people with depression, because people with depression, first of all, they have low vitamin D levels. Okay, other people say, well, it doesn't mean that vitamin D causes depression. All right. When people are depressed, then generally they're not going to eat well, they're not going to go outside, so they will not get vitamin D. That's fine. But what we do know is people with depression have low vitamin D. And number two, what we do know is vitamin D increases serotonin levels. Serotonin is that feel-good factor. When you have serotonin, you're feeling happy all the time. Your mood is good. You're feeling jovial, relaxed. Vitamin D increases that. Okay, so if you're feeling low, make sure you check out your vitamin D levels, and especially now in autumn and then winter, we have very less on here, and we have so much melanin in us that the synthesis of vitamin D, doesn't even work. So one study also found, so it's very good for mood regulation and preventing high levels of anxiety and depression. How many people do you know, especially ladies, who have anxiety and depression? They need vitamin D. And don't be put off by आपके vitamin D ठीक है का मतलब ये है कि you don't get scurvy, you don't get rickets, you don't get gingivitis. And well, you may have gingivitis, your teeth won't fall out, or you might have bleeding gums. You need to increase vitamin D under your GP supervision. I have to add. Let your GP know. But then do your own research. It's a two-way system with your GP. It's part of the NHS charter. The GPs have to, ask you to partake in your health. It's part of their, their statutory duties. It's in the NHS charter for GPs that they have to ask you to partake in your health journey. So it's a two-way street. Explore the options, look at your own research, put it in front of the GPs. It's not just having adequate levels, it's about having therapeutic levels. So vitamin D, very good. People who've got anxiety and depression can benefit from vitamin D. Improves mood, it can, in ladies with depression and anxiety. Number three, तो विटामिन डी जो है ना, बहुत जिनको घबराहट होती है, एंग्जाइटी होती है, उनके लिए भी बहुत मुफीद साबित हो सकती है विटामिन डी। अगर किसी के अंदर कम हो या कम ना भी हो, नॉर्मल भी हो, तो बढ़ाने के लिए उनके बहुत फ़ायदे हैं। क्या आदमी के मूड ठीक होता है, एंग्जाइटी चली जाती है। नंबर थ्री, द थर्ड थिंग दैट विटामिन डी डज, which is very, very beneficial, and we'll continue after the break, is that it might lower the risk of heart disease. They might lower the risk of heart disease, but inshallah, stay with us until after the break, and I'll tell you exactly how it can lower your risk of heart disease. So please stay with us until after the break. Until then, Assalamu alaikum wa rahmatullahi wa barakatuh.